Okay, next important question which is asked from the pharynx part is the structures passing between the various gaps in the pharynx. Okay, first of all, as you can see, this is the sorry, as you can see, this is the base of skull and this is superior constrictor muscle. So the structures between the this base of skull and the superior constrictor muscle are, first is, you can write here, first is your levator velli palatini muscle, levator velli palatini muscle, auditory tube, and third thing is ascending palatine artery. One more thing which you should remember, that this space, okay, which is covered by pharyngobasilar fascia also, this space between the base of skull and superior constrictor muscle, it is also called as the sinus of Morgagni. Clear? Okay, now this is the superior constrictor muscle, this is middle constrictor muscle, and here is the mylohyoid muscle. We should know that mylohyoid muscle, it forms the floor of oral cavity, that is oral diaphragm. Okay, now the space between this mylohyoid, lower border of superior constrictor and upper border of middle constrictor, this is a triangular shaped gap called as oropharyngeal triangle. Okay, now structures passing through this oropharyngeal triangle are your one is stylopharyngeus muscle. We had read na, between the styloid from the styloid process a muscle goes here like this. So stylopharyngeus muscle, along with that the nerve which supplies the stylopharyngeus, that is glossopharyngeal nerve. So two structures will pass through here. One will be stylopharyngeus and other will be the glossopharyngeal nerve which supplies this stylopharyngeus muscle. Okay, now third thing, this is inferior constrictor muscle starting from superior oblique, है ना, and this one is the lower fibers, lower cricopharyngeus fibers, which are transverse fibers of inferior constrictor. So first of all, the structures passing between the middle and the inferior constrictor are internal laryngeal vessels and nerve. Okay, also this superior laryngeal vessels, internal laryngeal nerve and vessels and superior laryngeal vessels. Clear? Okay, now between this inferior constrictor muscle and between this esophagus, below is esophagus, है ना, so the structures passing between inferior constrictor and esophagus, these are recurrent laryngeal nerve and inferior laryngeal vessels. Clear? Okay, so here I am repeating these gaps and structures again because this is a very important topic. First of all, as we had seen in that picture, that between the base of skull and superior constrictor muscle, levator velli palatini, eustachian tube and ascending palatine artery are there. Between superior and middle constrictor muscle, we had seen that stylopharyngeus muscle passes through, and along with that the nerve supplying this muscle, that is glossopharyngeal, that is the ninth cranial nerve. And between the middle and inferior constrictor muscle, internal laryngeal nerve and vessels pass, and below between inferior constrictor and esophagus, the recurrent laryngeal nerve and vessels pass through. Also, we had read that inferior constrictor muscle, it has two parts, thyropharyngeus having oblique fibers and cricopharyngeus below that having transverse fibers, and the gap between the two, it is called as Killian's dehiscence. Okay. Okay, now this image is again taken from Gray's Student Anatomy. Now we will talk about the parts of pharynx. Pharynx has three parts: the nasopharynx, the oropharynx, and the laryngo or the hypopharynx. First of all, the nasopharynx. This is the nasal cavity, okay, and this is the sphenoid bone. This is sphenoidal air sinus. The part which extends from basi sphenoid and basi occiput up to the level of soft palate. This is the nasopharynx. This pinkish part is nasopharynx. So we can say the roof of nasopharynx is formed by basi occiput and basi sphenoid. Floor is not complete, although it is formed by soft palate anteriorly and is deficient posteriorly. This is the nasopharyngeal isthmus between the nasopharynx and oropharynx. Okay, this nasopharyngeal isthmus, it is the communication between nasopharynx and oropharynx. The posterior wall of nasopharynx, it is formed by C1 vertebra and prevertebral muscles and fascia. Also, you should know, between its roof and the posterior wall of nasopharynx, there is a tonsil called as the pharyngeal tonsil or the adenoids. Clear? Okay, nasopharyngeal tonsil or the adenoids, it lies between the roof and the posterior wall. Clear? Another thing you can see is that anterior wall of nasopharynx is formed by guana, that is posterior nares. I am repeating the boundaries of nasopharynx first of all. Roof is formed by basi occiput and basi sphenoid. Anterior wall is formed by posterior nares. Floor is formed anteriorly by soft palate and posteriorly it is deficient. There is nasopharyngeal isthmus, and posteriorly there is C1 vertebra with prevertebral muscles and fascia. Okay. Now it is the lateral wall.